What was life like for you around that time before anything started?
It was actually very stressful. It was 2020. It was COVID, so we had a lot going on. The whole world had a lot going on, but we were getting married as well, so it was a lot. And then yeah, a lot came after a lot, and that was when things started to escalate a little bit more for me.
So, before you got diagnosed, was there anything that you were like feeling different about yourself?
Not like I wasn't really feeling differently about myself, but I noticed some blood in my stool. That was probably the one and the only thing that I would say was what I noticed different. But that was so minimal. I had what I would call droplets of blood in my stool, and it would come and it would go. And I think we look at those kinds of things, unless you have it in your head already to know that it's something, well, could be something quite serious. We either think it's a hemorrhoid, or we've wiped too hard, or it's been a big poo and it's like scraped or scratched, or, like that's just I think that's just what we're like.
Yeah. Or even endometriosis.
Yeah.
You can have it in your bowel.
Yeah,
So,
exactly. So that, and then, I mean, I was tired, but I wouldn't say like heavily fatigued by any means. And yeah, I would have random tummy aches here and there. But then again, being a woman, especially around like your cycle and things like that, we can get cramps. And I'm not saying that those things are normal, but you do sort of brush things off because you think it is just nothing.
When did you notice something didn't feel quite right?
So I think that I noticed the blood, I would say about, I'm going to say at least 3 or 4 months before my diagnosis. And I noticed it, yeah, like I said, I just kind of put it down to being absolutely nothing. But I had blood clots earlier that year too, in 2020. And those blood clots, we did find out, were brought on from the tumor in my rectum. But because I have a blood clotting disorder, which is hereditary and nothing to do with cancer at all, the doctors at that time didn't push for any further testing. They just said it was random. Yeah, pretty much.
Yeah.
So yeah, it would have been, so it was April in 2020 I had those clots, and then I was diagnosed in December 2020, so 8 months. But yeah, the blood, yeah, probably like 4 months beforehand.
Yeah.
Yeah.
Did you think it was something serious at that stage?
No. And that's purely because I didn't have the knowledge around bowel cancer at all. Yeah, hindsight's a wonderful thing. I think you reflect on it, and I do reflect on this often, is knowing what I know now. Any kind of blood that you're seeing in your stool should never be ignored. It doesn't matter if it's 1 or 2 drops. At least have it checked regardless, because you just don't know. There's a difference between having the blood and doing nothing, having the blood once and doing something.
What were you telling yourself when those signs kept showing up?
I think looking at blood in your poo, and this is so normal for us, it's not normal, but we make it normal. We just look at those sorts of things and go, oh, and then you think, I don't want to talk about that because that's about my poo, and for some reason we get all cagey and embarrassed. And I think it's so strange because every time I saw it, never did I look at it go and think it was something serious. And that's just, is it a bit of naivety? I don't know. I think probably because of the lack of blood and it being fresh.
Yeah.
I was never, nothing sort of, which I wish it did. Nothing screamed at me to be like, oh, go get it. And perhaps because I didn't have it every single day and it wasn't a lot, and yeah, it would just come and go. So it would go, and then I'd be like, okay, cool. And then,
yeah. It can also be just like lack of information on,
absolutely.
Thinking old people, it's an old people's disease. That's what we've always sort of thought.
Well, I get, for a long time that was the case, because that was the predominant, age group, was people older we're getting it. It's just things have changed in recent.
Looking back now, what do you wish you had known back then?
The signs and symptoms of bowel cancer.
Yeah, absolutely.
Yeah, just because they're not hard to learn either. But I think there is nothing. I don't recall ever being anywhere, not really, and seeing literally anything about it. I think in the whole time, I've probably seen 1 or 2 billboards that could even indicate that someone of my age could have it. Everything else is posters with people with white hair, like people are in their 70s. You know, there's a big gap between what is happening and what is available to people to help them understand.
Yeah.
Yeah.